Okay, so welcome to the International Society of Nephrology Pre-Congress interview series. I'm Augusto Santos Jr. I'm a nephrologist in Brazil and also an ISN social media team member for the World Congress of Nephrology 2021. With me today is Dr. Rolando Claure Del Granado. Dr. Rolando is a professor at the medicine at Universidad Mayor de San Simón School of Medicine in Cochabamba, Bolivia. He's also head of the Division of Nephrology, Dialysis, and Transplantation at Hospital Obrero. He's one of the co-chair of the Acute Kidney Injury Committee of the Latin American Society of Nephrology and Hypertension. And also, among other qualifications, he's a very active member of the International Society of Nephrology Social Media Task Force. So welcome, Rolando.
Thank you, Augusto, and thank you for the kind introduction. It's a pleasure for me to be here in this interview.
Thank you. So, as I just said, you have been a very active member of the ISN since the beginning of your career. Much of your work is on research in acute kidney injury. And also, I know that you love sports. You were an actual runner, an actual nephro runner, I would say. So one of the things I would like to ask you is how much have your life changed among these times of COVID-19 pandemic?
Well, that's an interesting question, and my life has changed a lot. For example, I was a guy who every day from Monday to Friday was using a suit and a tie or a bow tie, and now I use, as you could see, scraps all the time. And the workload we have been having the past year has been increased a lot. The clinical work, especially with patients with COVID-19, the amount of required renal replacement therapies that we need to perform daily at the ICU, at the wards, other nephrology and nephrology outpatient clinics has increased a lot. And in terms, as you said, I love to run, that was one of the most things that have impacted me, because at the very beginning of the pandemic, when we were all in a strict lockdown, I have to go outside my department in the building, and I have to run inside my apartment. So that's one of the things that really drove me crazy.
And also, you're going to be in a very special session at the WCN 2021, which is entitled "The Impact of COVID-19 Pandemic on Renal Services in Low-Middle Income Countries." So I have been thinking, what can we learn about the experience of low-income countries, and also how much do you think the experience in those countries are different? Do we have room for telehealth, or do we have different modalities being used? Can you tell us a bit about what is coming in your lecture?
Yeah, sure. I'm excited to present some data we have gathered together with some colleagues in the of SLAN and the AKI committee. So one of the things we learned through this pandemic is that most of the centers that have received most of these patients with AKI and COVID-19 have resources to treat patients who require dialysis. And in some places like big urban university hospitals, all types of renal replacement therapies are available. So you could either choose from therapies like IHD to prolonged intermittent renal replacement therapies. And also you could use CRRT and also PD. one of the things we found and we learned is that unfortunately PD is underused in most of the centers. There was none published articles in this regard, and it's a therapy that in these times and in this type of patients could be more used. That's one of the things I think the Latin American region has to work through, and also take advantage of some programs like Saving Young Lives and sister renal centers to improve the way we could provide renal replacement therapy to COVID-19 patients with AKI. Also, one of the issues we realized, or I realized during the pandemic, is the lack of data we have in Latin America. That's one of the things we have to really improve. We have just few studies that deal with the problem of AKI and the etiology, incidence, prevalence, adverse outcomes, etc. in the region, like the EPILAT era study that was published last year, and some surveys done by the AKI SLAN committee, which tell us the resources we have to treat the patients with COVID-19 and AKI who require renal replacement therapy. And also, I think that it's very important that Latin American researchers, physicians, nephrologists should be including those in every consensus like ADKI and KDIGO, because our experience is really important, because we always work in this crisis or emergency mode of doing things before the COVID-19 pandemic. And I think we deal better with this lack of resources, lack of dialysis solutions, lack of machines, shortage of healthcare personnel, etc. So I was reading, and I will discuss this in my lecture, that so many algorithms and plans were proposed by experts around the world and consensus, but none of these plans adequates what is our reality in low and low middle income countries. So I'm going to show these algorithms and these recommendations we have put together with a group of regional local experts in AKI. So how you will be able to provide renal replacement therapy in patients with AKI and COVID-19.
Okay, that's really great insights, and I also know you were very much passionate about technology and social media. And another question I was thinking is, we are going to have our first web-based World Congress of Nephrology, and the International Society of Nephrology is very keen to innovation. So how much do you think that technology can help us cover these gaps in education and also battle infodemics in low middle income countries?
That's a great point you make, Augusto. And I think technology, social media, online platforms are great resources for nephrologists, physicians, a team of young nephrologists around the world who provide amazing social media material and education. It's really important, because since that, and I think without this COVID-19 pandemic, not so many people will have access to these extraordinary educational resources ISN has. So we have I think ISN has approached more to these low and low middle income countries, and they are ISN is providing a great amount of free education and low-cost education resources.
I thank you so much for your time and your availability. It was great talking to you. I'm sure we're going to learn a lot from you at your lecture and also at your session. And I invite all the international nephrology community to attend your lecture and also to follow the ISN social media team channels. I'm sure that the World Congress of Nephrology 2021 will be a huge success. Thank you.
Thank you, and I want also to invite every member, especially young nephrologists around the world, to attend our meeting.